Hey everyone, I hope you can hear me. Dr. Lee here from Your Vet Online, and tonight I thought I'd share with you some of my little tricks and tips all about vaccinating dogs, these little guys. So while we wait for a few people to join us, I thought I'd introduce you all to Mordecai. He's a little Frenchie puppy, and he is, I think he's 11 or 12 weeks old now, and he's been getting vaccinated too. But he's very good. He's actually not mine, he's my neighbour's, but I'm his chief babysitter. So anyways, let's talk about vaccinating. I know that a lot of you have been having a lot of questions about vaccinating and can get quite confused about how to go about it with not only your puppies but also older dogs. And so one thing that I thought I'd help explain to you is exactly what the process is. So with vaccinations, what we're trying to do is there's a core group of vaccines, and there's also a group of vaccines which are non-core. Now the core group, we are trying to protect our dogs and our cats for that matter against the diseases that are canine parvovirus, canine adenovirus, and canine hepatitis. Now those are the core vaccines. Now the actual vaccines that are non-core are the ones that are things like leptospirosis and kennel cough, and in America it might be Lyme disease. Actually, just to put in for our American viewers, rabies is known as a core vaccine for the Americans. Anyway, so when we vaccinate, we want to make sure that we are doing the core diseases that cause disease in our pets. And those are the really nasty ones. Those are the ones that can actually kill them. So when we start vaccinating, and I actually see Hannah's written a little thing here, why are most vets ignoring the AVA and the WASA guidelines for core vaccinations in Australia? I'm not sure why you think that they are ignoring them. The practices that I've been in actually do the practice towards those guidelines. So Hannah, if you want to just clarify a little bit exactly what the question, how they're actually ignoring those guidelines, I'd love to know, and then maybe I can answer it a little bit better. Anyway, so when we get a little puppy, these little guys, when they are born, they actually receive maternal antibodies from their mother. And what that means is that the mother passes on through her milk antibodies against the diseases that she's either had and experienced herself, or that she's been vaccinated against. I was going to let this little guy down for a bit. He can have a hoon around. And you see now the maternal antibodies are passed on to the puppy and to help protect them when they're really young. Now those antibodies can actually last up until they're about 16 weeks old. And so that's why we have a period of vaccination that can be anywhere from starting at 6 weeks old, going all the way to 16 weeks old. Now, if you live in an area that has high numbers of parvovirus, then you want to vaccinate and make sure that your last vaccination is as close to 16 weeks as possible. Otherwise, the potential there is that those maternal antibodies will interfere with how the vaccine causes the immune response within that puppy. So when we say that we're going to vaccinate our puppies, we usually do 3 vaccinations, and it's usually a month apart. They usually start between the age of 6 to 8 weeks and carry on until 14 to 16 weeks. And the reason why we need to keep boostering like that is actually because of those maternal antibodies. Now, he's got my duster, he's having a little play here. Now, if you start at a later date, like if let's say you've just got a new dog and you vaccinate after the age of 16 weeks, then it's not going to matter. You don't need to do all those vaccination boosters, because the whole reason why you're doing those is actually because of the maternal antibodies. Now, the trouble, where we get into trouble is that some of the vaccine companies now have said that the last vaccination can be performed at 10 weeks of age. Now, that's all very well and good if you live in an area that doesn't have a lot of parvo or hepatitis or distemper. However, the problem then becomes that when you do live in an area where there is high risk, some of those puppies still may have maternal antibodies that affect the way those that vaccine actually works for them. So there is a very small risk that you may actually still get those diseases, even though the company says it's fine. So that's why many vets actually choose to vaccinate more and beyond the 10-week age, just to ensure that your puppy is going to be protected. Now, the other thing that we hear of quite often is that should we be vaccinating every year? Now, this is when we get into the trickiness, because some vaccines have only got claims made by the manufacturer that state that they are good to go only for 1 year. Now, if you're using a brand of vaccine like that, then to be protected, you need to do what the label says. There are new vaccines out though that have extended that claim to 3 years. And so that means that you can, once the dog has had its primary vaccination course as a puppy, it then is vaccinated at a year old, and it can be, it's good to go for another 3 years before it's vaccinated again. Now, that's for the parvovirus, hepatitis, and adenovirus, or what we call C3 vaccine. Where people, I think, are getting confused, and they think that vets are being a little bit dishonest, is when they say that vets are saying that they have to come in every year for a vaccination. The idea of coming in yearly is actually to have a health check more than anything. And during that time, and when the vet is talking to you, they'll get an idea of what you do with your dog. So if your dog goes into kennels, if you frequent puppy play school, if you're going to, if you go to dog training groups, some of those groups actually have rules that say that they demand that your dog is vaccinated against kennel cough. If that's the case, it's a non-core vaccine, and it doesn't have the best immunity, and it doesn't last for that long, the immunity, I mean. So you do have to give it every year. The same goes for leptospirosis. That's another disease that's a bit the same. So in those situations, we vaccinate every year. This little monster's doing monster things. Let's see what he's up to. So hello to Mordecai, everyone. Anyway, yeah, so that might be one of the reasons why you think that vets are not being completely honest when it comes to actually saying that you're getting a vaccination yearly, because some dogs will get it and others won't. But it's the one thing that's really, really important is that you do actually come and have a yearly examination with a veterinarian, regardless of whether you are getting vaccinated for anything at all. So one of the other things that, what is Hannah saying here? They are recommending annual repeat vaccinations instead of triannual with no timer test. I think you mean Titre test. Okay, all right. So I'm not sure who your vet is, Hannah, but I'd say that that's quite unlikely to be happening. And the only reason why they might be doing a yearly vaccination is because they are actually using a brand of vaccine that doesn't have a 3-year claim. Now, your other part of your question, which talks about Titre testing, now that's a really good point. So if you live in an area that is really high risk for parvo, and parvo is our main problem in this part of the world, it lasts in the environment from an awfully long time. So it can last longer than 7 years, and it's really hard to get rid of. So it's a nasty, nasty disease that kills a lot of animals, and the treatment is really, really expensive. So I would say that that was our main issue. Now, Titre testing, if you live in an area that has a high risk of parvo, so we know that places like Broken Hill, for example, in Australia, there's really high prevalence of parvovirus, I'd be tempted to recommend a Titre test at around 16 weeks, well, 2 weeks after the dog's 16-week vaccination, to check whether that dog has actually had a response to that vaccination. Because generally speaking, after that vaccination, the dog doesn't get vaccinated again until it's a year old. And that means that's a very long time to be exposed if the vaccine hasn't worked appropriately. So, Titre test, and if anyone doesn't understand what Titre testing is, basically you're taking a little bit of blood and you are checking to see whether there are antibodies against the disease that you've vaccinated against. And for diseases like parvovirus, we know that that's any sign of antibody means that we don't need to vaccinate again. It's one of those diseases that's got very clear evidence that if we see antibodies, we're good to go. Now, if you see no antibodies and it's negative, you need to vaccinate. Very, very clear rules on this one. Now, as far as what you're saying, Hannah, about whether we should be doing Titre testing our older dogs, that's up to the vet and their client. So if, as a client, you prefer your dog to have a Titre test before they're vaccinated, that's absolutely fine. No one's going to be upset by that at all. And basically, yeah, there's no problems with doing that at all. Now the dog is, what are you doing? You've been naughty. Come and say hello to everybody. Come and say hello. He hasn't had dinner yet. I think he might be a bit hungry. You're not allowed to lick me either. So hello, everyone. So yeah, so Titre testing is a really good idea if you don't want to give too many vaccinations to your dog. It's also a good idea in the young ones to just make sure that we're not, so that they're definitely covered, so we're not leaving them exposed in that time frame between sort of 4 months old to a year old, when if they had high levels of maternal antibodies, it's possible that they weren't covered appropriately. So that's a really good question. What has Sarah asked here? Can a dog get kennel cough from getting the vaccine to prevent it? Okay, so kennel cough, if they've received the vaccination that is in the, what are you doing? I think he wants to leave the room. Come here. Sorry, I've just lost my train of thought there. So the kennel cough. Okay. So if they've received the vaccination up the nostrils, which is the intranasal form, then yes, there is a localized reaction in that area. And part of that is actually getting a very, very, very mild form of kennel cough. It's not a full-blown disease, but it's a very mild form, and it's basically creating enough to make sure the dog creates immunity to that disease. Is it going to be bad? No. Is it going to make them extremely sick? No. I'm just going to let this little guy out because he's having a meltdown. You can go and hang out there. Sorry, guys. He was just going to have a meltdown there. Okay, Hannah's asked another question. I use a holistic or integrative vet, and they test a Titre test only. All the vets are vaccinating annually for corona. She get a bait, or I don't want to be. Oh, I'm sorry to hear that, Hannah. I mean, I think times are changing. Maybe the veterinarians that they spoke to didn't understand. So yeah, it's one of those things. I think times are changing. You'll find that many vets will start to Titre test more as our knowledge improves, and also as people start asking for it. It's not going to hurt any animal to have a vaccination every year. It's just not going to hurt. So there is no such thing as over vaccinating in that sense. No worries, Sarah. Right, my vet is only vaccinating 3 years C3. Yes. Now, cats, yes, they are still only getting vaccinated yearly, and this has got to do with how the vaccine is formulated and the response that the animal has to the vaccine. So yeah, cats definitely, they are still an annual situation. It's a little bit like with horses. If we talk about horses as well, we've got a vaccine like tetanus that can last up to 5 years, and we know that. However, strangles, it's only a year. So you've got different vaccines, different responses to the body, and so you have different reactions. So yeah, it really depends on the vaccination. So I hope that answers your question there. Are there any other questions? Also, I've added a little link up the top for a little gift for you guys, because I know how difficult it can be sometimes when you go to the vet. You have all these problems you want to talk about, all these things that happen with your pet, and sometimes you just forget to tell the vet. So I've put a little link up there that says that if you hit that, it'll take you through, and you can download a little checklist. You can write it out, all your little problems that you have with your pet. It reminds you to write down things like what you're feeding them, any sort of issues that they might be having at home, and it's basically a chance for you to be reminded about what's happening with them, and so that you can tell your veterinarian. Because regardless of whether an animal is vaccinated every single year, they do need a yearly health exam. A yearly health exam is so important because it allows the veterinarian to really see how your pet is in all aspects of their body and well-being. So we talk about their diet, we talk about their behavior, and we talk about their we do a full clinical exam. We make sure that they are able to do the daily activities normally. Like, are they having problems going to the toilet? That might not be a problem with their urinary system at all. It could be a function of them having arthritis. So it's really important to consider seeing your veterinarian every year for a health check. Anyways, I hope this has been really helpful for you guys. If there's any more questions on vaccinations, I do have the 2 links up. I'll put those in. Did I put them up? I think I might have put them in before. And they are papers that I've written that go into this a little bit more detail. And if you can always ask us questions on the website, yourvetonline.com. And I'll endeavour to get back and answer those questions there, or you can ask some more questions on this post. And anyway, I hope this was helpful. I hope to do this every Tuesday at 7 o'clock with a little topic. So if you've got any topics that you want me to talk about, just give us a private message or put it in the comments below and we'll get right onto it. All right then, guys, I hope you have a fabulous evening, and I hope those answered the questions about vaccinations for you. All right then, catch you later. Bye.